Hi folks, this is Dr. Rob Cywes. I am the Carb Addiction Doc, and today we're going to discuss a specific topic that I see a lot in my office, especially early on in my patients. The majority of folks that come to visit me on the standard American diet are hypertensive. They have high blood pressure. And most doctors out there call it essential hypertension. Oh, we don't know what it is. We don't know why you've got hypertension, but it's genetic and you're going to be on this blood pressure medication for the rest of your life. And they put you on a couple of blood pressure medications. They experiment with your blood pressure. And then they put you on a diuretic to pee out water, because obviously water in your bloodstream causes hypertension. And to a certain extent, they're right. Your heart and your blood vessels are very, very simple to understand. And yet they pay cardiologists lots of money to understand something simple. It's a pump. Sorry, cardiologist, just my plug at you. It's a pump. The heart is a 4-chamber pump. And it squeezes and it relaxes. And how often it squeezes, the more often it squeezes, the less volume there is per stroke. It's called the stroke volume. So the slower your heart rate, the more the heart fills with fluid, the more powerful those strokes are going to be, the bigger the bolus of blood typically is. And the power of the heart, the intensity and the strength to which it should function, is often a function of the size of the muscles of the heart, particularly the left side of the heart, that pumps blood through your body. And that muscle gets thicker when it's really having to pump hard. And the reason it usually has to pump hard is because of an excess of fluid in the system, or because the pipes that it's pumping through are narrowed, either because they're in spasm or because they've got plaque or other crap that's lining them. So to understand hypertension is not that difficult in terms of the mechanics. It is related to the stroke volume, how much and how fast the heart is pumping, and also the force that has to be used to pump through those vessels, and that is often a volume and a blood vessel related thing. So the simple principles of hypertension is to slow the heart rate down, which increases your stroke volume, to decrease the amount of volume in the system with some sort of a diuretic to pee out or sweat out or get rid of that extra fluid, and also to relax or widen the diameter of the blood vessels, especially the proximal, the higher blood vessels, through which you're pumping. And obviously some of that is fixed by plaque or by calcium, and some of it is dynamic because all those arteries are very elastic. And then there's always a place where the blood will pool as a reservoir outside of the heart. You don't want that pool to be in your ankles or your lower back while you sleep. You certainly don't want that pool to be in your lungs. That's called pulmonary edema or peripheral edema, swelling. So you don't want that pool of fluid to be too big. You also don't want it to be too empty. That's dehydration. And all blood pressure medications really work on those three principles. They either reduce the volume, we call that diuretics, or they lower the heart rate, we call those beta blockers. They block the rate at which the heart beats. Or, with a variety of different mechanisms, we stretch out or we relax the blood vessels, including the heart, because the heart's just a modified blood vessel, relax them, so that flow is easier, you don't need to generate as much pressure, and in those ways we bring blood pressure down. It's not difficult to understand. Now, the human body controls blood volume and blood pressure extremely tightly. And ultimately, the most important regulatory mechanism of blood flow is blood flow to the brain. And there's something called postural hypotension, where you don't get enough blood to the brain, and within a few seconds you're fainting. So the brain is a primary trendsetter for your blood pressure. Too little, you're fainting. Too much, you're getting a headache, you're getting a migraine, and potentially those vessels, those fine vessels in your brain can pop, and you get something called a hemorrhagic aneurysm, a stroke. So controlling blood pressure is critically important. And it's very, very tightly controlled by a system, a chemical system called the renin-angiotensin system. And it works between certain areas of the kidney, which control blood pressure through chemicals. Your lungs are involved. And then your blood vessels respond to those chemicals that are produced by the renin-angiotensin system. And a lot of the medications for blood pressure mess with that renin-angiotensin system, shut it down, reduce it, or increase other components to allow your blood vessels to stretch open, to slow the heart rate down, whatever that may be. So those are the mechanisms of the medication. However, the human body primarily uses one molecule, which governs the entirety of blood volume, blood pressure, and the entire renin-angiotensin system is geared toward modifying the single molecule. The single molecule, folks, is salt. Sodium chloride, salt. And the entirety of the vascular system in terms of pressure and volume is fundamentally based upon salt dynamics. So the human body is very, very, very specific in terms of how tightly it controls sodium levels in the bloodstream. And you can measure that with a blood test. We measure it with a venous blood test. And it's always very tight around 140. It may go up 1 or 2 points, down 1 or 2 points, but more than about a 4 to 5 point shift off that 140, you're in all kinds of very, very serious trouble. And doctors who do critical care, emergency care, very, very tightly regulate sodium levels. But the human body is also extremely good at regulating salt. The human body really struggles with sodium deficiency. It'll retain salt, it'll reduce salt waste, but it can't help itself. Come back to that in a second. However, excess salt is very, very easily gotten rid of. There is no such thing as excess salt when you consume it by mouth. How do you get rid of it? Think about this, folks. There's 3 different major pathways to get rid of salt. And most people don't know what the first one is. I'll give you a clue. The third one is sweat. When you sweat, you don't sweat water, you sweat salt. The second one is the kidneys. Most people think that's the first one. The kidneys are a very, very effective sodium regulation system. You pee salt out at the top of the kidney, water chases salt. Remember that, water chases salt. And then at the back half of the kidney, just before you pee out, you either reabsorb that salt or not. And diuretics block the reabsorption of salt, and they exchange other electrolytes or other protons for sodium. That's how the kidneys work. It's a sodium fluid exchange system. They can keep the salt or lose it. That's how you preserve it. But the most important, the largest transformation, the largest change in sodium occurs in the colon, the human colon. And in carnivores, the exchange of salt into the colon is what makes healthy poop together with fat and fluid. But if you're in a net negative sodium balance, if your body needs sodium to manage blood pressure, it is actually going to suck salt out of your poop, out of the fluid in your colon. And that's going to dry up your poop, so you're pooping little hard balls. So you want the traffic of sodium to be from the bloodstream out into the colon as a waste product into the urine. But you don't want to drink so much that you're peeing all the time. If you look at most animals, all animals normally pee highly concentrated urine. The urine isn't the color of water. It's dark and yellow. Because hydration, folks, hydration is not about water. Hydration is about salt. And salt regulates that. And if animals are peeing dilute urine, they've overdrunk, and there's no biologic necessity to overdrink water. So put that in the context of all these idiots on the internet. Oh, you must hydrate, you must drink so much water. That's bullshit that has come across in the last 50 years because of another dynamic, which we're going to talk about in a second. Because if you are regulating your blood pressure with a sodium system, of course, there are other things that can affect your blood pressure. But by far the majority of essential hypertension, we don't know. In other words, we've excluded the common suspects or the more rare suspects. Okay? But the sodium system is the most important system. Now, over the last 50 to 70 years, we human beings have done an amazing job of completely screwing up that delicate sodium fluid blood pressure balance, which is so tightly controlled. And we've completely destroyed that system with one molecule that looks identical to salt. And it acts exactly the same in the blood vascular space. And that molecule, folks, is glucose. A 6-sided carbon molecule that is very hydrophilic, it loves water, and it sucks up water like a sponge, just like salt. So as we've consumed more and more carbohydrates, and most people on a standard American diet are somewhere between 70 and 80% of their calories as a carbohydrate, whether it's starch and sugar, but it's glucose that enters the bloodstream. And when glucose enters the bloodstream, it sucks up a lot of water because it's hygroscopic. Just pour some water on a table and throw some sugar and throw some salt on it, and you'll see it'll either dissolve or it'll suck it up. But that's what sugar does. Sugar retains water with it. Sugar travels with water. So it's when you eat the sugar and it goes into your bloodstream, it sucks up all that sugar into your bloodstream, which is fine. Now you've got this extra fluid to deal with, and your heart's having to pump faster and stronger. So your stroke rate goes up, your stroke volume goes up, so the pressure is going up. And that's a paradox. Because when your stroke rate goes up, your stroke volume should go down. So now you're getting high blood pressure. And what happens is after a meal, you take that sugar and you're exchanging the sugar for salt. So your sodium levels drift down a little bit. They're at the bottom end of normal. They're still in the normal range. But your sugar levels are like this. So you've got all this extra water. And now you use up the sugar or you turn the sugar fat. So you see this massive plunge of your blood sugar. So you're getting these huge swings in blood pressure throughout the day and the night. That's not good for your blood vessels. That's not good for your brain. Think about this. After lunch, the 2 hours after lunch are the worst work time during the day. Why? Because everybody's gone out, they've pigged out on their carbohydrates, they've eaten their pizza or their pasta, their blood pressure has now gone up, the pressure to the brain has gone up, and the brain, it's like a damn concussion. The brain has been wackadoodled with sugar and water. It's swollen, and just a little swelling of the brain in this box radically affects the brain's function. And then all that fluid goes away. Now you can function a little bit better, but your blood pressure is doing this. It doesn't know what the hell to do, fluctuating all the time. So what do the doctors do? Because now you're starting to get essential hypertension, and what's worse, instead of just the fluctuations, where your blood sugar goes up and then comes back down to normal, as you become insulin resistant, your blood sugar goes up and it stays up, because even when you're not eating, your liver is producing sugar, and you've got this massive load of sugar that we call diabetes or prediabetes in your blood system. Instead of your blood sugar being 83 or 85, it's now 110, 120, 130, sucking up a lot more water with normal sodium. So you develop under those conditions chronically elevated volume that the heart can't cope with, plus that sugar is swelling the endothelial cells, narrowing your pipes, and possibly even laying down some plaque. All a horrible, horrible, horrible contribution toward chronic hypertension that we call essential hypertension, but it isn't. It should be carbophilic, sugar-based hypertension, carbohydrate hypertension. But what the doctors do is they put you on blood pressure medication, and then they keep adding more and more medications that all mess. Every medication messes with the salt system, which is the normal system, because none of them focus on the sugar. And then you're condemned to that blood pressure medication for the rest of your life that doesn't adequately control your blood pressure because it still fluctuates when you're not looking. Nobody ever checks their blood pressure on a regular basis at home, which you should be doing if you've got hypertension. Check your pressure every day so you know whether it's low, normal, or high. That's so obvious. You can see how animated I get. But folks, if you've got hypertension, essential hypertension, they found no other cause. Oh, we don't know what causes it. It's genetic. No, it's not. It's carbophilic hypertension. And the only way you're going to know that is if you sustainably get rid of the sugar. And if your blood sugar levels are in the 80s, mine typically runs 65 to 75, sometimes up to 80, sometimes a little higher. But my average blood sugar is below 85. And I eat a ton of salt, and salt is critically important to consume to excess when you don't consume sugar. So don't consume salt and sugar together. I agree with the conventional doctors. That's the worst of all scenarios. But what they do is they ignore the sugar and they tell you don't use salt. So you're on a low salt, high carbohydrate diet. That's ridiculous. But I agree with them. Don't have both high. But the correct way to do it is do to your body what it's supposed to do. Get rid of the sugar, bring your sugar levels down, and have high sodium levels. So when I tell my patients to consume large amounts of salt, it isn't quackery because it is done in the context of a low carbohydrate diet. I am the carb addiction doc. Those doctors out there, yes, they're correct in blaming you, don't put salt on your food, because you're still on a high carbohydrate diet. Yes, I agree with them. Doesn't do very well, but you don't want both high. They're just targeting the wrong guy. They're shooting the healthy guy and ignoring the criminal. The criminal is sugar. So if you are going on a ketogenic diet and you bring your sugars down and you restore insulin sensitivity, it doesn't happen like this. You need to be eating higher salt, but your blood sugar and your blood pressure will regulate. And so will your heart rate. Because if your blood volume's down and your pipes are open, your pressure has to be down. You don't need that much pressure to have a normal pressure in your brain. And your stroke volume goes down and your stroke volume may go up a little bit, but your pressure goes down and your stroke rate goes down too. So this morning, my blood pressure, and I check it every day, 110/60 with a heart rate of 54. A little higher now, I'm a little animated. But that's normal. That's normal. And I eat a ton of sugar. Sorry, whoa. There's a little Freudian desirable slip there. I eat a ton of salt. I eat 3 to 5 grams of salt a day. I mix an iodized salt, a cheap iodized salt to give me some adequate iodine with my Redmond's real salt, which is my pink salt with a lot of electrolytes in it. I mix those two and put them in my salt shakers. And I eat a lot of salt. And if that was true that salt caused hypertension, I'd be dead right now. I can feel my pulse. It's slow, but it's still there. So people put this into context. This is a long video, but it's so important to understand. Because the commonest cause of your death is going to be a cardiovascular or a vascular inflammatory disease. Think about that. A stroke or a heart attack is by far the commonest cause of death. And it's not just cholesterol and plaque. We forget about hypertension. We forget about high blood pressure as a contributor to all of that injury. We forget about sugar as the primary contributor to that injury. Does that make sense to you? It does to me. I am the carb addiction doc. If you want help managing your hypertension, almost ideally to get rid of it rather than continue with your blood pressure medication. If you want empowerment as to how you can control this yourself, we can teach you. Set up a visit, 561-517-0642. If you like the content of this, perhaps share it with your doctor, take that risk. But more importantly, drop us a few dollars on our Patreon account, Carb Addiction Doc, or throw some money at us on our PayPal account at Carb Addiction. PayPal account is robert@jackschildren.com. And that's a charitable organization. We don't profit from that. We use it to produce these videos. I am the Carb Addiction Doc. Look at the show notes below us for this information. Take care till the next time. Eat salt. Don't eat sugar.